Good morning and welcome to this food summit that we're having. I'm Charmaine Ruddock. I'm the director for Bronx Health Reach, and on behalf of the entire Bronx Health Reach Coalition and the Institute for Family Health, which leads the coalition, we welcome you. We're excited about the conversations and discussions we're going to have here today. I want to thank all those who've agreed to speak, share their thoughts and ideas about the work they're doing to improve access to healthier food at the local, at the state, and at the national levels. Bronx Health Reach, founded in 1999 as a grantee of the Centers for Disease Control and Prevention's REACH initiative, a unique cornerstone effort in the federal government around approaching racial and ethnic health disparities at the community level. At the start of Bronx Health Reach, the community action plan that we put together with its focus on primary prevention efforts had us providing nutrition education at churches, after-school programs, and at a housing and economic development community-based organization. But as so many of you know from your experience working with communities, that when communities lead, they will challenge you to do a lot more than you originally planned or even thought of. So with that, the churches we were working with thought that they needed to take the nutrition education they were gaining and change the foods that they provided at church events, not discarding the foods, but making them healthier. Many of them even re-engineered their kitchens. The after-school program brought in-house the preparation of the food that they served the children to ensure that it was healthier and in keeping with what they were learning about eating healthy. And at the time, the newly formed Nutrition Fitness Work Group determined that the very food environment in the community needed to be changed. So we went into schools, bodegas, supermarkets, mom and pop restaurants, food pantries to encourage them to serve healthier food, all with the idea that we would work to change the systems and policies that would eventually lead to a healthier food environment. It has not been easy. In March 2010, the New York Times published an article titled "The Obesity Hunger Paradox." And in that article, the reporter wrote of a recent survey that found that the most severe hunger-related problems in the nation was actually in the South Bronx, long one of the country's capitals of obesity. They cited experts that said that these are not parallel problems, the problems of obesity and hunger that persist in side-by-side neighborhood, but actually plagues often seen in the same households, even the same person. The hungriest people in America today, the author continued, statistically speaking, may well not be sickly skinny, but excessively fat. In that article, they called it the Bronx paradox. Not much has changed since that on a wide scale level. In the same year of that article in 2010, the Robert Wood Johnson Foundation put out its first county health rankings report. And since that time and every year since, the Bronx has been ranked 62 out of the 62 counties in New York State in health outcomes and the factors contributing to those outcomes. It is therefore why when the White House announced its conference and national strategy to address hunger, nutrition, and health, we understood that the Bronx had to be involved in this national call to action and to power through innovative initiatives that so many had been thinking about, planning, and even working on. This conference is part of that conversation and call to action. I know I am, and I suspect all of you are looking forward to what we're going to do here, to get inspired by and take actions that will start. So with that, let's get started. I'm going to turn this over to Kelly Molson for Kelly to then introduce us to our next speakers. Kelly.
Thanks, Charmaine. In the meantime, we'll turn it over to U.S. Department of Agriculture Regional Administrator for the Northeast, who is Lizbeth Silbermann. Ms. Silbermann, would you like to give a couple of minutes of opening remarks?
Sure, Kelly. Thank you so much. Good morning. I appreciate the opportunity to join you on behalf of the USDA and give you a brief overview of who we are and the work we're doing to better integrate nutrition and health. Without question, FNS's administration of our 16 nutrition assistance programs is at the core of our agency's mission and our department-wide approach to advance food and nutrition security. These programs include the Supplemental Nutrition Assistance Program, or SNAP for short, formerly known as the Food Stamp Program, the Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC for short, our child nutrition programs, food distribution programs, and emergency food assistance. Collectively, these programs are the most far-reaching and powerful tools available to the federal government to ensure that everyone in this country has access to healthy, safe, affordable food. Our programs reach 1 in 4 Americans over the course of a year. In addition to our nutrition assistance programs, USDA also invests more than $1 billion per year on nutrition education and promotion efforts across all of our programs. At USDA, we also translate the dietary guidelines for Americans through MyPlate and have a broader investment in research and food systems. We recently released a short video highlighting our efforts to advance food and nutrition security and to ensure everyone in this country thrives. I encourage you to watch it, and it can be found on the USDA website at www.usda.gov. The video briefly captures how we have been working over the last 2 years to drive change through policies, programs, and practices to ensure equitable access to healthy, safe, and affordable foods for everyone in this country. And this work has a demonstrated return on investment. One study found that SNAP participation was associated with approximately $1,400 per year in lower subsequent healthcare expenditures. For a comparison, the national average monthly benefit for fiscal year 2018 was $239 per person, or just under $3,000 annually. So SNAP has the potential to lower healthcare expenditures that equals about half of what we invested in the supplemental food benefits. And that's the power of healthy foods. That's the power of better integrating nutrition and health. And that's the power of all of us coming to the table to think bigger and bolder about our work together. Over the last 2 years, the Biden-Harris administration has pushed all federal agencies to drive change around equity through policies, programs, and practices. At USDA, we have been focusing our efforts on changes that would have the greatest potential for ensuring equitable access to healthy, safe, and affordable foods. This work includes establishing the first USDA Equity Commission and having each of our agencies across the department develop equity plans. We're also working to build awareness among our staff and key partners about the sizable body of research indicating that structural racism harms health in ways that can be described, measured, and dismantled. And we're also carefully examining our existing and potential policies to identify ways to prioritize health equity and address the social determinants of health. This is where nutrition security comes in, and where we at USDA and each of you here today can have influence. You are trusted messengers that can elevate the power of our programs. You can also help us understand missed opportunities and innovative options that are ahead for us. The historic White House Conference on Hunger, Nutrition, and Health held about a year ago and the release of the corresponding national strategy are both great examples of how we can work together. This collaborative work involves more than 20 federal agencies and thousands of diverse voices around the country. The day after the White House conference, the USDA Food and Nutrition Service released a report highlighting how we are aiming to leverage the momentum of the historic White House conference and help implement the national strategy to help reach the conference goals to end hunger, improve nutrition and physical activity, and reduce diet-related diseases and disparities. As we approach the first anniversary, I want to encourage attendees today to think about new and enhanced efforts where we can work together to accelerate progress on the White House conference goals. In closing, the USDA is grateful for your work every day to help families and individuals across this country thrive. I barely touched the surface of our programs and the initiatives underway to strengthen the connections between food and health. So I encourage you to visit the USDA website to learn more. Please reach out to the regional offices to share your ideas or lift up your relevant work. Let's maximize the moment to help everyone in this country thrive. Thank you so much.
Thank you so much, Lizbeth. The USDA is a really important partner in this work, so we appreciate you coming on and sharing with us. And we are going to do what we can to make the connections with the National Strategy on Hunger, Nutrition, and Health. So thank you.
Great. Thank you so much.
So I'd like to introduce Bronx Borough President Vanessa Gibson, who has been a longtime champion for food justice in the Bronx. So thank you so much for being with us this morning, Ms. Gibson.
Thank you so much. Good morning, everyone. Happy Thursday to each and every one of you. I am Bronx Borough President Vanessa L. Gibson. I hope everyone is healthy, well, and safe. It's an honor to join all of you for this important conversation this morning. A special recognition to Bronx Health Reach and the Institute for Family Health, longtime partners of mine as an elected official in the Bronx, for convening this food summit 1 year after the White House's conference on hunger, nutrition, and health. Thank you to all of our stakeholders, our advocates, our leaders, policymakers, thought leaders, and everyone for joining us in this conversation this morning. I would like to also recognize and thank the U.S. Department of Agriculture, Teachers College, as well as Corbin Hill Food Project. We'd like to thank as well the Director of New York Good Food Purchasing, the Morrisania WIC program right here in our borough, the Bodega and Small Business Group, Collective Fair, the Center for Science in the Public Interest, Mary Mitchell Family and Youth Center, great partners in the Belmont community, Manna of Life Ministries in Morrisania, as well as the NYU Stern School of Business. Thank you all for being here this morning. We truly know that reducing hunger, taking a bite out of hunger, and promoting healthy food alternatives has always been a priority for me personally and professionally. My entire career as an elected official, from an intern in the New York State Assembly to a member of the New York State Assembly, a member of the New York City Council, and now as the 14th Bronx Borough President, this has been a long priority of mine. As a member of the City Council, I was able to fund Love Health Bucks, which is the Department of Health and Human Services, DOHMH, their sponsored program that provides access to our farmers markets and our youth markets around our city and around our borough. I also sponsored legislation that was codified into local law that requires the Mayor's Office of Food Policy to develop a 10-year food policy strategy. Food insecurity is a major problem for families all over the country, but certainly right here in our borough of the Bronx. And it severely hurts our ability to develop healthier students, families, as well as our communities. Efforts have truly been made, progress has been made to help provide fresh fruit, vegetables, as well as cooking demonstrations in many of our highest need areas, vulnerable communities, older adults, many families with small school-aged children. Our city has pioneered the use of green markets in our city, and this is the season right now. I want them to be all year round as a priority, and we're working towards that. and really providing more fresh produce in our communities, as well as an increasing number of farmers markets. And we love community gardens that are volunteer-led. Green thumbs as well. And the Bronx Borough President's Office is proud to support creating more local food connections, food hubs, hydroponic gardens, vertical farming. We love all of this creative efforts to achieve food equity and food justice, helping local retailers sell healthier options like bodega bucks, which we talked about over the years, and expanding healthy food options in our schools. We all know about Meatless Mondays that Mayor Eric Adams is very proud of. We love our chef friends at Wellness in the Schools, great partners joining us on many of our health and wellness days, who are really working hard to transform our school lunch menu, making it attractive for young people, but also knowing that it's healthy at the same time. Also want to recognize our good friend, Stephen Ritz at Green Bronx Machine, doing amazing work across the country, but he started right here in the Bronx. Hunger Free NYC, Joel Berg and his team that are always trying to take a big bite out of hunger. Health people, we are grateful to work with C. Virginia Fields, the former Manhattan Borough President. She's a part of our diabetes task force. And Bronx Health Reach, Charmaine Ruddock and her entire team, who do all of the work in the trenches, the real work in our communities each and every day. Since July, our office has coordinated with various organizations and credible messengers and trusted partners, including Eat Clean Bro, who we love, New York Common Pantry, ICNA Relief, many other organizations to deliver not only fresh produce, but also pre-cooked, prepared meals to many of our NYCHA developments in New York City Housing Authority. Families have also been provided with gift cards this summer to use at their local supermarkets to purchase fresh fruits and vegetables. Thus far, we have provided more than 800 meals to NYCHA residents across the borough, and we look forward to developing more partnerships. Many other communities are in need that will really help our families facing food disparities. Food equity must truly be at the center of any conversation in all spaces in our borough around health. We must work together to develop creative and innovative solutions to making food more accessible to all. And that includes healthy food, which we know at times can be more expensive. And it should not be about how much you have in your bank account, but it really should be about access and opportunity. Education, programs, outreach, town halls, working groups, panel discussions, press conferences, rallies, meeting clients where they are all important. But ultimately, what has a lasting impact in our work is creating protective and supportive public health laws. Policy work is what leads to transformative change. We appreciate each one of you who has joined us on this fight every single day to ending hunger and improving health outcomes. Not 62, the campaign that started several years ago under the Office of the Bronx Borough President with Bronx Health Reach, should not and is not a hashtag, but it really is a matter of our purpose to make a difference, to no longer be first in everything bad and last in everything good. But working with all of you, we are changing that narrative, and we are talking about the progressive work that we are doing to focus on success stories and not statistics. We know the statistics, we know the data, and most importantly, we know the faces behind that data. And it was so evident during COVID-19 when families struggled for basic necessities like accessing food, long lines at food pantries and soup kitchens, and really a lot of them were at capacity. They were running out of food. And I'm so thankful that we had organizations like ICNA Relief and Common Pantry and Manna of Life, and so many that really stepped up in a major way to help our neighbors in need. We appreciate all of you for joining this effort. And I also want to say that in our borough of the Bronx, October 17th, we are proclaiming as Food Justice Day in the borough of the Bronx, and it serves to remind all of us that raising awareness and honoring the seminal work of organizations like the Bronx Health Reach, the Institute for Family Health, and so many others is so critical to this ongoing work. I want to recognize my team. I cannot do this work as your borough president without an amazing health and human services team. Our director, Dr. Nancy Keck, our deputy director, Maknoor Jora, and everyone in this office that does this work every single day. Bronx Health Matters, and we have a newsletter that we have been producing and publishing available on our website, and we produce it quarterly, called Bronx Health Matters. Whether we're talking about lupus, diabetes, heart disease, HIV/AIDS awareness, maternal health, healthy eating, healthy living, efforts like Boogie on the Boulevard, summer streets, opening up our streets for walking and bike riding and jogging, all of that is important. We have Tour de Bronx coming up on October 22nd, the largest cycling event in the state, because we want to encourage bike riding. We know that is attributed to reducing these poor health outcomes in our county. So we are very excited. I hope you feel the energy from Bronx Borough Hall, that we are excited about getting this work done, and we will not leave families, children, and older adults behind. No matter where you live, how much is in your bank account, it does not matter. Every family should have access to healthy food, education, outreach, and meeting our clients where they are. I thank you all for your time this morning, and I look forward to working with you as we achieve food equity and food justice in our borough, in our city, and certainly in our state. And we again thank the White House and the Department of Agriculture for their incredible leadership. And we look forward to making a real difference in the lives of the families that we represent each and every day. Thank you so very much. Thank you.
Thank you so much, Ms. Gibson. It's always a pleasure to have you on and remind us about everything going on in the Bronx. You have your finger on the pulse, and it's really, really refreshing to hear that. So thank you.
We're ready. We're ready.